Here at EMA, we're fortunate to have a really great friend who is also a doctor. And let's be honest, this is a time where we all want to look to doctors for pretty much everything. And so Dr. Jay Lemery is a professor of emergency medicine at the University of Colorado School of Medicine, chief of the section of wilderness medicine, sits on the National Academy of Medicine's Roundtable on Environmental Health Sciences, Research in Medicine, is a physician consultant to NASA's Human Resources Program. I secretly always wanted to be an astronaut, so that's very cool. And did I mention that he's also an author, public speaker, and a consultant for the CDC? That's a lot. So I'm the lucky one who gets to talk to him today. So let's bring out Dr. J. Hi.
Hi, friends. Hello.
I don't have quite as many credentials as you yet, but I'm getting there. I plant gardens sometimes with Kathy. Okay, so Dr. J, about this pandemic. Oh, is that your call
yes.
button? I see. Okay. I didn't get one of those either. Asher. It's there.
Oh, Shazam.
Don't go too far in advance. Let me ask the questions first.
About the pandemic.
Okay, we want to talk about the pandemic, obviously, because we've got a doctor here. Can you just start by explaining what a pandemic is and if pandemics are environmentally motivated?
Yeah, so that's a big question. Pandemic. So the thing I think is important to understand is that this pandemic gets people sick.
Yeah.
It's sneaky in that it sits with us for a week before even we know we're sick or we can get tested. So we won't even know for another week whether this is a super spreader event, Debbie. So just oh my God, totally kidding. Everyone's vaccinated. It spreads, and so it's infectious. So this is really kind of a perfect storm, and 800,000 Americans have perished from this, and many more have been sick, and worldwide, we don't even know the number. So there's a lot there. What is compounding this? Well, okay, so there's kind of three different ways a pandemic can mellow out. It can burn out, which is what Ebola does. People get so sick so fast that it doesn't spread so fast. It can be it can burn out. As it does in Africa. People can get vaccinated. So, and again, that's something that we're having problems with in America because
are we?
50% right now, I think it's 50% of people aren't vaccinated, and kids can't get vaccinated, right? So that's the other thing. And then, or we can just kind of let people keep getting sick until we get this thing called herd immunity, which is about 70%. So we have a long way to go to do that. So again, we right now are suffering from people that don't want to get vaccinated. People we love dearly, our children, cannot get vaccinated. So we're kind of living through this slow motion horror film where we know it's going to happen. We're watching it happen. There's a sniper out there where if you get COVID and you're not vaccinated, you're probably fine. In fact, undoubtedly, you're very likely to be fine. But enough people are going to get really sick, kidneys will shut down and die and be hospitalized and have long COVID syndrome and all those awful other things. So it's that's kind of where we're at. And I think we're all struggling with it.
And I know that someone earlier asked you about kids getting vaccinated, and you said,
expletive, yes.
Yeah,
absolutely.
Yeah.
So we talked a little bit backstage where we want to do a little bit of a Q&A. So if anyone has something interesting to say, Asher's given us
or even ask
an
questions
hour
throughout this, please do raise your hands. Because we want to make this a conversation more than just me up here asking Dr. J. I do have a few questions for you, but Alex, yeah?
I asked you already, but maybe other people care, but can you explain why it is so safe or so necessary to vaccinate your children? Is that
Well, sure. So the question is why vaccinate kids? Yeah. And it's the same reason we vaccinate ourselves is that when you get the disease or your immune system's like, we've been here before, we got it. And all those awful sequelae of a disease don't kick in. You may get the sniffles, you may have a low-grade fever, but you're not going to get super sick. And that's what vaccines do. We don't have smallpox anymore. None of us have had diphtheria, measles, mumps, or rubella. And that's wonderful. What is horrible is that, can you imagine if we had the problems we did now in the 1950s and 60s, in that post-war, surge in biomedicine where we had all these vaccines, come out. So, what it's going to do is it protects all of us from really bad sequelae of these diseases. That makes sense.
Yeah. Oh, we got another question right here. Kelly.
Hey, Kelly.
A doctor who was saying that we should be really worried about the Lambda variant, and that the Lambda variant is now widespread in Texas.
Can you guys hear over there?
We can repeat it, yeah. So
I was just asking a little bit about the Lambda variant. So last night I was talking.
I figured it'd be easier to do it like this.
Can you hear me?
yeah.
Okay, sorry. I was asking about the Lambda variant. I had heard last night that that was far more contagious and had much greater effects on the human body than even Delta does. I was wondering, Dr. J, if you knew a little bit about Lambda.
No, I don't. I actually don't know much about it. I know that these viruses are always changing. What we do know is that the vaccines cover a broad swath of the larger family of coronaviruses that are of the COVID-19 variants. So you will absolutely have some protection. I don't think I can speak more than that, but you're not naive to COVID-19 Lambda variant. Remember, it's a variant of a virus. It's not a new virus.
Yeah.
Yes, Debbie.
I have a question. And I just thought of this. So I grew up, I got the chickenpox, I've got the measles. When I was older and then I had kids, I had no hesitation to give them those shots. I don't remember a world where people were like, oh, here's a chickenpox vaccine, and somebody said, I don't want to take that. No, never mind. So this whole resisting taking the vaccine is confusing to me, because there's so many vaccines that you get as children that have eradicated all these diseases. Why do you think that there's this, like, there's a big part of the population that doesn't want to get vaccinated?
I mean, I'll say, the first thing I'll say is it's very hard to do our jobs, because when we're confronted with a patient who is denying the vaccine, it's confronted me, and I've been doing this for 20 years, and I've never been in a situation where I have to go to a place I've never had to find empathy and compassion. And a lot of us are just flat out furious and angry. So that's difficult. There are other people who are experts in sociology who have articulated exactly what is going on: tribalism, selective media, all that sort of thing. I'll just tell you, the thing that I think we try to do is really lean into that doctor-patient relationship. And, science, we don't care about science. We're just here to talk about your health, disarm a little bit and try and turn the corner. Bhargavi and I were talking about this yesterday, one of our fellows who will make home in a second. So it's really, that's where we need to lean in to that doctor-patient relationship and sort of, frankly, get all the noise that's circulating around out of the room and have a quiet conversation. So can we scale that up? Can we scale that up across different sectors of our community? I don't know the answer to that, but I know we have some success doing that when we can lean on our white coats and say, you trust me with all sorts of stuff. When I say you need surgery, you need this medicine, we still hold the public trust, patients to say, second opinions notwithstanding, like, okay, doc. So we still have that in a very cynical world. And I think that's the key. How do we scale that up? I've tried. We have a program where we try to get out there and profess these things and promulgate these ideas and write op-eds and so forth. And I don't know how successful we are there, but again, in that clinical setting, there's some chance of that. But still, there's lots of people who are just steadfast refuse to get the vaccine, and they come up with these crazy reasons why. The rationale, I can't understand.
And a lot of it comes from media, doesn't it? And all this. I mean, we've witnessed a lot of the bashing of science over the past decade, and that it's a hard fight to fight. What do you say about all of this?
That's right. Yeah, lots of science bashing, and again, I go back to that. We can never compete in that arena, but we are trusted messengers. We know that the data, communication scientists tell us that. Nurses are actually better than physicians. Nurses are at the top, but doctors are right there too. So if we hold true to that, don't start to talk about other affiliated political issues and really stick to the health. In some ways, we can be as apolitical as possible in this world. And I think that's the whole premise of our program, which is climate and health, emphasis on health. That's our expertise. I'm not going to talk to you about carbon capture or, regulatory things in industry. That's other people's jobs. If I stick to why is this important to you? In, the lives of our parents, our kids, our communities, then that's the message we want to absolutely resonate.
Yeah, it hits home. You were saying sort of how you link climate and health together, which is a very interesting concept. Just the thought of, like we were talking backstage again, just about doctors would recommend not to smoke cigarettes and tobacco. And so to bring climate in as a health factor is just an interesting way. You wrote a book about it, didn't you?
Enviromedics.
Enviromedics,
At
which I think is such a great
bookstores.
title for a book. But how is it all linked? I'm just so curious, how our environment and our climate is linked to our health at this moment.
Thanks for asking, Malin. So
You're welcome.
up here, you'll see this is a slide from the CDC. And actually, it's not particularly design, hasn't won any design awards, but this is, every time I give an interview, I actually pull this up because it's such a complicated question. And even myself, who spent so much time in this, I just look, that inner circle are the drivers, right? Sea level rise, carbon dioxide, rising temperatures. Some people say there should be 3, but we'll just say there's 4 primary drivers, extreme weather. And then the next circle is the effects on our ecosystem, right? Poor weather, poor air pollution, we get that. Water insecurity, drought, extreme weather events. And then of course the rectangle is the human health impacts of that. So a very elegant way of just sort of showing that cascade. But, there's 8 major categories here. And a lot of them could easily, you look at forced migration, civil conflict, and mental health impacts. Imagine what the people in New York right now or the Gulf Coast are feeling and how they will be feeling for weeks and months. That list is actually much longer than 8 boxes.
Yeah, we forget about the mental health factor sometimes, don't we?
That's huge.
Of
Absolutely.
how it impacts.
Yeah. I mean, kids right now, climate dysphoria.
Yeah.
I mean, I grew up when Cold War bomb shelters were being built and fallout shelters, and we watched The Day After. Anyone see that movie? Remember that? It was just, it just was designed to scare that out of kids, right? And so I feel like that's there. And then, of course, the direct impacts from people that are forcibly displaced, have lost loved ones, their homes. My sister lost her house in upstate New York from an extreme weather event, and I'm sure everyone has a very, not far removed from those stories.
Can you just scroll up a little, because these are the wrong cue cards, so I'm just wheeling it down here right now. Right, so this is a good one too about pandemics and illnesses. Is it because of our abuse of our wilderness and national resources, which I guess you've sort of touched upon, but do you want to expand on that a little bit?
Yeah, so I think the question is, what's going on with our ecosystems and how does that play into this? So it's not, climate change is, we're nuking our ecosystems with climate change, but also our land use policies, overfishing, how we build our cities and build our, agriculture changes our biodiversity, our interface with nature, the ecosystems that provide a little bit of check and balance within a system get out of whack. That's how we have pangolins making out with bats in Wuhan. So this is, ecosystems that are off balance absolutely impact human health. There's a great story that I wrote about years ago, which is in the 1950s in the Argentine Pampas, they clear cut to put in a cash crop. I can't remember what it was. And so this rich ecosystem was plowed. They put in this grain, and this one mouse that could thrive carried a hemorrhagic virus. And what happened was there was an outbreak of what was called Argentine hemorrhagic fever. You know, it's like Ebola type fever, a virus, and it ran rampant. And that's just an elegant, very cause and effect way of saying, you know, these things cascade in ways we never, you know, often can't pick up on. You know, these ecosystems out of whack. So it's very much related to this conversation on climate change.
Does anyone have any questions so far while we're going? Yeah. Hi.
Can you explain the RNA vaccine compared to older type vaccines and why people are afraid of it?
No, I can't actually. There's a few physicians I'm looking at. If you guys are feeling confident, I'm going to hand you the mic.
Do you want to explain does anyone want to take that, by the way? Does anyone know? You want to?
Yep. Well,
Well,
Emily and
let's
Bar, why don't
invite.
you guys.
You have two friends here. Yeah.
These are our fellows. These are physicians who just finished training.
Come on up, ladies,
Fellows.
please. Here, I'll give you. Did you want to introduce them, Dr. J?
Yeah. So this is Bar Chakuri, who is now living in Washington, and Emily Spiroli, who's in San Diego. And they're physicians, family medicine and emergency medicine, and they're doing a one-year fellowship with us in climate and health science policy. So these are practicing doctors that are taking a year to learn all about this, to be credible, knowledgeable, and effective leaders when they're done. And they actually have federal placements at USGCRP and the Environmental Protection Agency. So they're getting firsthand training. Yeah.
Thanks, guys.
Yeah,
It's great to be here.
So
Thanks for coming. Did you want to
We can
answer that?
tackle
You
that.
said you could probably answer that question.
let's see if we can tackle that.
Okay.
So I work in the emergency room, only emergency medicine. So I do encounter a lot of folks who don't want to get vaccinated, don't even want to get tested because they think that I'm giving them COVID by testing them. I mean, a lot of kind of difficult presentations basically that they have. But in terms of, from my understanding and how the vaccines actually work and why it maybe is so controversial, is that the mRNA vaccine is a fairly newer technology. It is something that has been around for at least 20 years or so, 20 or 30 years, but hasn't actually been deployed on a large scale in the way that it is right now. It's a much cheaper vaccine to make, and it's synthetic. It's entirely synthetic, so all the ingredients in the vaccine are made in a lab, whereas the more traditional vaccines that we use for things like measles, mumps, rubella, all that, takes a kind of dead version or a part of a live virus that then is introduced into the body and produces an immune response. So the mRNA vaccine is kind of scary to some people who already were hesitant about, medicine in general, drugs in general, these kinds of things. And it's also hasn't, like I said earlier, not been deployed on such a large scale that it is right now. The idea is that it's going to become a very quick way of making vaccines and a much cheaper way of making vaccines so that it can be used all over the world and deployed all over the world. And so countries that typically couldn't afford a regular vaccine could afford something like an mRNA vaccine in the future. So it's something new. It's easily attacked because it's something new. People just aren't used to the change, in my opinion. I personally, got the mRNA vaccine, and there's an argument to be made for, and when the booster comes around, to maybe even get a different version of the vaccines, things like that. But that's all to be seen. Yeah.
There was a time when medical advances were seen as a wonderful thing.
Exactly.
Antibiotics.
Yeah.
Cancer drugs. Like, oh my God, thank you. You've invented something. Those are the stories of the 20th century in America, right? So there's clearly been a perversion with this as now being a threat to our health, right?
Yeah, and when I was in medical school, I learned that mRNA vaccines were the future, and it has arrived. So, this is modern medicine at its best. This is what happens when you have all of your resources go to find a solution to a global pandemic.
I grew up with a mother who was an anti-vaxxer, and it was a hard jump to, especially when I had my son, to figure out vaccines in general because the fear of God had been put into me, and I had to take all the vaccines to get my green card here, and then of course, have made many smart decisions now about vaccines. But it's really interesting how even having a conversation with my mom now, she's still on the train of anti-vaxxing. She really has a hard time. And to speak to people that way, I feel like it's just a lack of, it's misinformation, obviously. And but it's so powerful right now. It has such a big booming voice. And it's so scary. And I don't really have a point to this, but, I just feel like the challenges that you guys have, I really do think that doctors have that power right now. And like you said, if there's a way to get the word out there without using science, because science has been bashed so much recently, to just have the credibility and the trust of your doctors, of your trusty doctor, that has never really gone away. Although now it sounds like they're questioning whether you're giving them COVID with a Q-tip.
Right. Well, that's kind of the scary part and the concern, and that also, harkens back to this climate crisis too. Is as a new physician, I feel like our profession is a little bit threatened. It's a little bit, people are losing faith in a system that is meant to help people. Almost every single doctor I know has gone into the field because they want to help people, because they are dedicated to the truth. And now it's kind of being bastardized by this, politicalization of this pandemic. And so and I was chatting with Renee about it earlier too, that I just don't want that to happen with the climate crisis as well, whereas, it starts to become this like huge political thing, and it already is. But more doctors and more health professionals are entering into the sphere because it is such a big public health problem. And our voices, are they going to be trusted or not, right? Are they going to start being associated with this big political issue? And then now it's, we're going to lose our credibility. And that's kind of one of the worries that I personally have.
Of course. Well, talk a little bit about that, about climate medicine, speaking of the climate crisis and all that. What is that, and how can you guys bring that in?
Yeah. So I think healthcare providers are on the front lines of climate change every day today. Anyone from a child coming in with an asthma exacerbation to my nursing home patients who are being admitted because they were exposed to air quality, poor air quality, or they didn't have enough AC in their nursing home. I mean, these are our family members who are getting sick and coming in, and I'm seeing them in the exam room. And I think at some point it just sort of clicked to me that, I'm a family doc, so we talk a lot about prevention and really getting to kind of trying to find the cure and not just treat the symptoms. And so for me, it just sort of started clicking once I started seeing patients as a doctor, because I felt like we weren't talking about the elephant in the room. And so part of it is being able to talk to patients and communities about part of what's making them sick and what they can do to help them get healthier and live the healthy and full lives that they want to with their families. And these two are ER docs, so they see people usually on the worst day of their life. But I see people in the clinic, and they're usually choosing to come to me, and I have a lot more time to talk to them. And so, there's that part of climate medicine, and then there's the other piece of it of we are a profession where we're trusted messengers of science. And we should be at the table in terms of coming up with solutions to the largest public health emergency of the century.
Thank you. Yeah, Dr. James.
Yeah, it's when we think about this concept of called climate medicine, which we're sort of framing, it's how are we going to prepare anyone who touches somebody for a living, in the healthcare in the healthcare realm, nurse, doctor, PAs, pharmacists. How do we get them to contextualize all this extraordinarily complex change, multifactorial, into improving patient care? Not only for the patients, but also for the systems that have to be there for the patients. So how do we keep our hospitals safe? How do we handle surges that come in from extreme weather events? And so there's a lot there. And it's shocking that across medical education, even hospital systems, we are so far behind right now. So I think there's a lot to be hopeful for. So I'll just maybe pivot to that for a second.
Yes, please.
I actually think it's been a pretty good year. With all this said, I think we have seen a huge mobilization of federal dollars in a bipartisan manner. And we've seen a vaccine that got developed. The vaccine hit in March, and it was in my arm as a healthcare provider, probably you guys too, in December. That is insane how quickly that happened. And we saw large-scale behavior changes, right? For all the anti-mask protests that are out there, the vast majority of Americans change their behavior, and we're happy to do it. So I think we've seen public opinion changed, even with the conservative parts of the country. Those needles are moving, maybe not fast enough, but they are moving. We've seen incredible advances in renewables, batteries, wind and solar, where they're now the market can support their, as opposed to needing a federal subsidy. And then to the points that were made this morning, we are now seeing huge mobilization for big change that only government can do because the private sector just can't do it. So 2 days ago, our colleague in Washington, we saw that he was named the interim director for the Health and Human Services, right? That monstrous health department of our government, for the Office of Climate Change and Health Equity, right? There's an office for that, and it's the federal government's going to do it, right? That's just one little shiny asterisk on a big government mobilization. So it's very different than when we were here a couple of years ago, Debbie. And so I think, I'm going to turn it over to you guys, but I think that alone makes me feel like we're at an inflection point. And just another pitch to Emma, because this group absolutely has helped and is helping us amplify our voices, because we know it's all hands on deck and we need it.
Ladies, do you have anything to add to that?
About from the hopeful part of you?
Yeah. Leave us with some hope here.
Yeah, I think there's, well, thank you guys for having us. Thank you to Debbie. I mean, as a physician, I don't get to interact with a lot of people who are non-healthcare sector folks that are into this. So it's amazing to see this room of so many motivated people who are in everywhere in society kind of doing this work from every angle. So I think that's, probably the crux of this, that's what's going to get us through. Where, it's not necessarily a concerted effort, but it needs to be done from every angle. So I think that the more we do this, the better off we are, and the faster we'll get it done.
Absolutely.
Yeah, and I talk to my patients about climate change now that I've learned about this, and I feel hopeful because I don't really have to convince people that it's real or that it's not happening. People get it, I think, more and more. And I have the privilege of being able to frame it in terms of how it's affecting their health and their family and their goals. And kind of going back to that doctor-patient relationship, I feel like there's so much opportunity as a doctor and as health professionals to really help prevent illness, promote health, and help people live longer and better.
Thank you, guys. Thank you for everything that you do. It's incredible. Does anyone have any questions, by the way? Does anyone want to follow up on anything? Now that we have these doctors on stage.
Yeah.
Yeah.
Can I add something? More than a comment and a question. What you guys are Gabriel. One of the things that I do, and I'm from Arizona, is I'm the director of the Traditional Practitioners Program for the Northern Arizona Regional Behavioral Health Authority. And part of what you're talking about, the medicine and climate coming together is something that traditional practitioners in Indian country have been doing for thousands of years. And more recently, on July 30th, we brought a delegation of Native Americans from the state of Arizona. At least 50 of us came out here to a space between Malibu and Thousand Oaks, a sacred space where they had ceremonies specifically for climate change. And so while that was happening here across on the East Coast in Washington, D.C., the same thing was happening on that same day. So I just wanted to say that those things are happening within the Native American circles, and I wanted to share that. But I think you bring up a good point. I think we as Native people feel like we need to be at the table with in these conversations also with climate change. So I just wanted to say that. So thank you.
Thank you. Agreed.
I have one last. I have a question. I have a question.
Yes, Asher, what is your question?
This is a dumb question. I'm prefacing it. Why is it that like all of the events, all like natural disasters, tend to happen at the same time together every year? Like fires and floods, and I'm saying this is a completely fucking stupid question. I'm sure there's a really good answer to this. But I always wondered why it's like the end of the summer, early fall. I know why forest fires happen at this time of year, but why do the floods happen at the same time as the forest fires?
Whose line of expertise is this? Who would like to answer this?
No.
I got this one. I got this one. No, I don't know. I would defer to almost anyone else in the room, but I'll say it's the northern hemisphere, and it's when the most energy is in the system and the most land is in the northern hemisphere. So I don't actually think that that's true, but
By the way,
yeah.
I've never heard that.
Yeah.
Yes.
And we have hyper energized systems,
That was
and
a great answer.
and so it gets the hottest July, August. You could think about the hurricanes. They have all that energy, and they spaz out not in June, but in August,
So the
September.
energy that like the heat on one side is creating the hurricanes on the other side.
It's a first law of thermodynamics. So part of the problem with
feel like that's-
global warming. No, I'm saying no. This is actually really it's intuitive. The problem with global warming is that we're adding all these emissions into the atmosphere, right? And we're increasing the amount of heat that's there. The first law of thermodynamics says that the more heat you add to a system, the more unpredictable it becomes, and the more difficult it is to like ascertain where it's going to go and what's going to happen. So that's basically the bottom line of why this is all such a huge problem.
That was an
And-
amazing answer.
Well,
Drop that mic.
well, no, that's why this is such a big problem and why the climate models are so difficult to make, why this tends to be such a polarizing topic, because it's such an unpredictable system that a lot of the quote science and a lot of the studies that come out tend to err on the side of just being, okay, this is what we think is happening. This is an unpredictable system, but this is what we think is going on. And then, unfortunately, some folks jump on it and they say, no, it's not certain, so therefore it cannot be this and that, right? So, but that's for your weather question. That's hard, just to put what Jay said to the actual science answer of that.
Thank you for clarifying. That was amazing. Do any of you have anything else you'd like to share before we finish up here? No? Any other questions? All right. I'm dragging this on. We've been at 0 for a long time. Yes.
Yeah, I think there is a little avoidance of the elephant in the room, as Bar said. There's a reverence for ignorance in this country. And I don't know if the passive approach that I hear is going to be that effective. And one of the examples I'll give is on Tucker Carlson one night when Governor Newsom brought in a board of people about the environment and about COVID. He said he only wanted people who had scientific backgrounds. And Tucker Carlson said, your opinion, he said this to his audience, is not welcome at that table. And he doubled down by bringing Huckabee on, saying what they're telling you is God is not allowed at that table. I love what Barr said to me earlier today. But I think this passive approach is not working. And I don't know how we argue with them. Let me not say argue. How do we discuss with a person who says God is against everything you three are saying?
So I guess, I mean, I deal with this every day. I was practicing in New Hampshire. That's where I did my residency program. And I think the answer is really to have empathy for the people that we're talking to. Because what I find when I'm talking to someone who doesn't want to take the vaccine or, you know, doesn't trust me or the science that I'm bringing to the table, I ask them to tell me what their worries and what their concerns are. And then we talk about it, doctor to patient. And I think physicians and healthcare providers, nurses, counselors have that capacity to have that conversation with society, right? We can talk to each other as people and cut through a lot of that radio and sort of actually address their worries and concerns, because it's always coming from that place. And I think, you know, as physicians, we're trained to tap into that.
Yes, but you're talking about people who are coming to you. How do we reach the people that don't come about the environment and about COVID? And I think that's the elephant in the room that we never talk about.
We actually, in our fellowship, just had a chat with Ed Maybach, and his answer to that question is we just leave them behind. We just keep going. You know, you know the truth is, and
Yeah.
Yes, yeah.
Sorry.
We have one more question from Alex.
Question. So when my friends are hesitant to get the vaccine, whether they're like about to get pregnant or they are pregnant, or like I have some of my friends who they're like, we're scared to give our daughters the shot. I am not. I'm for getting my kids and everyone a shot. What can you say to them, or why are people so concerned about later on with their daughters not being able to have babies or getting pregnant with this vaccine? I'm so confused about that.
Yeah, I mean, I would say the first thing to say to them is to talk to their doctor,
Yeah.
because I think that's who you should be having medical conversations with, right? It's not Facebook. That's not where you should be getting your medical
Where
advice.
did this come from that everyone keeps saying, like,
Yeah.
is it from the media, or is there some truth to the fact that it could have long-term effects on reproduction?
When I tried to look into this, because I have several friends as well and some family members who are concerned about the same thing, particularly with female reproductive health, my understanding was that earlier in the year, there was a study from Japan that came out, and they were looking at mouse ovaries that got the mRNA vaccine in their trials, right? And they happened to find that there were higher levels of the COVID vaccine spike protein in ovarian tissue. That's it. That's the study that a lot of it came from. There have been subsequent studies that have shown that, yes, even though that was the case for these mice, they did studies in Israel on women who got the vaccine, and they obviously looked at reproductive rates. They looked at people who needed to undergo IVF, and there was no difference in their reproductive capabilities. Why those studies are now not being put forward, I don't know. Why they're not as viral as some of those initial ones were, but that was my understanding of where that came from. And I think there was also another one with the Johnson & Johnson vaccine early on that was concerned about male fertility, which was then debunked. So that's why we don't hear about that one anymore. But for the female reproductive issue with the mRNA vaccine, I believe it came from that initial study done in Japan on mouse ovaries.
But couldn't it also be said that the side effects of COVID are so much worse than the vaccine? I mean, I feel like a lot of people who are afraid of the vaccine are not taking into consideration the actual effects and long-term effects of COVID itself, which is such a fascinating.
Well, and that's why I say empathy, because you need to talk to people and ask, what are you worried about and what are your concerns and how can we address them knowing the science that we have available, right? And that conversation should be with your doctor or your nurse practitioner or, someone who's there in the room to talk to you about your health goals. And you can't do that on a Facebook thread.
Or just tell them not to be silly and just go get the vaccine. Just go. Guys, that is our time. We have taken up so much of your time. We have a lot of people. Thank you so much for being here today. Appreciate it.